Hello, I'm Kevin Friard, a board member for the Society of Participatory Medicine. Today I'm speaking with one of the founders of SPM, Danny Sands, to get his perspective on our signature project, the Collaborative Healthcare Action Measurement Platform, or CHAMP. So, Danny, you've been doing this a long time. What was the light bulb moment that convinced you healthcare needed to go in this direction?
In my own practice, as I was practicing side by side with doing informatics, I had this aha moment, which is that I realized as I would prescribe websites to patients or communicate with them over email or other things, I realized that these technologies were equally empowering and even more so to patients and family caregivers. And that was a really important aha moment. It really changed the way I thought about healthcare and even about information technology. Back in the 90s, when I was traveling around the world and the country talking about how important it is to communicate with patients on email, doctors were laughing at me. They said, "Why would you ever do that? This is insane." And as patient portals became more ubiquitous, doctors were starting to get it. They said, "Oh, I understand why this is important." So that's changed. And then, of course, patients' access to their information, their records, has changed a lot because portals are so ubiquitous. And of course, now it's the law of the land, so that you have to let patients see their health information as soon as it's available within your practice or health system. Overall, I think we're seeing the trends moving in the right direction, and I'm happy about that.
Why has SPM decided to create a measure of participatoriness?
I think it's really important for us to understand why some people are having a collaborative, sharing, participatory experience in healthcare and other people aren't. And what are the predictors of that? Is it because of geography? Is it because I have a lot of chronic conditions? Is it because I'm from a marginalized community? So I want to understand how people are experiencing their healthcare. That's what I want to do. And I want to be able to understand where we can maybe intervene in some way to improve the experience that people are having. And by the way, I think this is an experiential thing for both patients and physicians, because physicians lose the meaning of their work. They lose the joy in practice if all they are trying to do is get through the day and they feel like a cog in the wheel. This is about making your work more meaningful.
Right now, so right at this point, mid 2026, what do you see as the most important steps for making CHAMP, our measurement tool, a reality?
So we have done an incredible amount of work on this project since we conceived of it. We have an incredible team of people who are working on that. We've contracted with a survey expert, Kate DeRoche, who's the executive director of Open Notes, and this is just fantastic. She'll be our head of research. And we have this separate but related stream of work, which is that we're working with a very talented individual to mine the medical literature to make the case for the value of participatory medicine. So the question is, if we do a survey like this, then does it matter? Does it make a difference? So we've got a lot of pieces in place, but one of the things we need to do is we need additional funding to develop the questionnaire and to test it, and then to finalize it and then field it to the 1,500 or 2,000 people we need to respond to this. All of that is resource intensive. It requires a lot of capital, and that's why we're talking to organizations and individuals to help us raise the funds for this. And then once we're generating data, then it gets very exciting. You can reach people and explain to them, wow, this is what's going on. Is this the kind of healthcare you're experiencing? Is this the kind of thing that you want? How can we make this better? So I'm very excited about the momentum that we're building here and all that we've done.
I share your excitement with how far we've come. Now it's starting to feel like there's something coming into focus. I can envision what it will look like. So let me ask you, as a physician, what do you hope having CHAMP will actually provide or accomplish?
I want physicians to really understand that this can increase their joy in practice and that their patients are going to like this. I want physicians to say, hey, maybe I should be thinking about the way I work with patients a little bit differently. That's the idea of this. This is why I'm so excited about participatory medicine. It's about the patient pushing the physician to be more participatory and the physician pushing the patient to be more participatory. It's like a good relationship.
Let's look ahead 5 years. Um, Imagine CHAMP's been established and we've got a few years of data in the books. what other opportunities do you think that'll open for participatory medicine and SPM as an organization?
So I want to increase awareness about not only participatory medicine, but about the Society for Participatory Medicine. I want this to be the start of many projects that we'll be able to do to instill our healthcare system with more participatory medicine. But we've come a long way in healthcare. We're still not nearly where we need to be. And every day people come up to me and tell me stories about, bad things that have happened in their healthcare interactions. I hear this all the time. And that's not okay. We spend so much on healthcare in this country, more than any other country in the world per capita, and we're not getting the results that we want. And part of that is that we're not working with patients in the right way. The ultimate goal for me, Kevin, is that I want the organization not to have to exist anymore. I want this to be the norm. And I want SPM to not have to exist because it's irrelevant. This is normal healthcare, and anything that's not participatory is an outlier.
That's a great goal. So before we go, is there anything I did not ask you about that you would want to add?
People often say, well, in order to do this participatory medicine stuff, I need more time. I need to get paid more. Okay, I get that, but I still believe that this is a value. It would be nice if we had more time with our patients. There's no question that would be best. But I think we can change our practice philosophies, change our attitude without adding more time to the visit.
You seem to have joy in medicine, joy in practice, joy in what you're doing, and you haven't gotten the more time or higher pay for it. You've gotten better use of the time. So I think that's a fantastic place to close. And thank you very much for spending some time with us today.
Of course, Kevin. It's great talking to you.